Live from the Trustmark Studios, from simple checking to complex loans and services, no matter what challenges your business may be facing. And there are many. Count on the team at trustmark.com/business for more information. Dr. Clay Hayes, President, Mississippi State Medical Association. Good morning, sir. How are you?
Good morning, Paul. How are you doing?
I'm doing dandy. So far, so good. You almost feel like you're being stalked when you go out in public and leave. You leave. As kids, we played safe base. When you take your foot off of safe base, when you get out in public, you feel like you're being stalked by the virus. I will say this: I had to do some tests yesterday, the annual test, and got a couple of more as you make the rounds of doctors on a yearly basis. And at the facilities that I went to, there is separation. Everybody's doing what they're supposed to be doing, mask and everything else. So for the people who do have to have some checkups or their annuals, I think our medical community in the state of Mississippi is a relatively safe place. Would you agree, sir?
Absolutely. It's really important to manage the main things, too. We don't need to forget about checkups. And as the kids, we talk about going back to school and all this and making sure they have their vaccination. That's really important. And I think the pediatricians and the family medicine docs and the internists and all those primary care folks are doing a great job trying to take care of Mississippians.
I got to ask you your thoughts and the thoughts of the medical association as far as the school situation.
Well, obviously we have some concerns. That's just a big or large amount of folks getting back together, and we're trying to give them some guidance about how best to do that. Now, that obviously is up to each school district, and obviously the governor is getting involved, and the health department is giving good advice. So It's a challenge. There's no question about that.
Do you think it can be done safely?
I do, although it needs to be done in phases. I don't think we need to go all at one time. I think still having the option of doing virtual classes and that sort of thing is the right thing to do. Even, my son's going back to medical school, and they have 170 people in their class, and they're having kids go back 50 at a time and then doing the other parts of the class virtually. So they're figuring it out. That's what's important is how do you figure it out?
I never thought about it in that particular field, in that industry. It's very little you can do, I would imagine, as far as distance learning in achieving that degree to become a doctor. You have to be on scene.
Well, that's the challenge. Some of the rotations for the third-year medical students, it's hard to do surgery or deliver babies virtually, and they need to have that experience to get that done. So. Yeah. But, it's not how you get into trouble, it's how you get out, and that's what we're trying to figure out.
Please ask Dr. Hayes, this is on the C-Spire text line. Please ask Dr. Hayes why the AAMC, the AACOM, the governing bodies of the medical schools, have ended in-person interviews and limited audition rotations for the thousands of medical students who are applying to residency programs. Imagine having to interview over Zoom for the possibility of getting a 4-year residency spot. The USA needs more doctors. This has literally suppressed the ability to grow more doctors into the workforce. This is a crisis that nobody's talking about.
No, I'm sure it is very challenging, and also trying to take test exams. For example, the first-year medical students after their second year, they take a step 1 exam, and they have to have these centers where they go to, and they've been overwhelmed to try to have these testing facilities. And again, it's trying to figure that out, and that's part of being a doctor. You try one treatment plan. If it doesn't work, you try something else. So you always have to you have to be thinking about that. And so I'm sure people are frustrated by not being able to get their interviews. But this is not just related to medicine. It's in all fields. Business as well. I'm sure they're having to do interviews over Zoom and Skype and whatever. But it's just you just got to keep pressing on.
Why do you think there's such a controversy over hydroxychloroquine?
Well, I think it's the jury's still out. People don't know whether it really works. Some people think it does. Some people are not sure. There are a lot of randomized trials that are ongoing. I know people are frustrated. They want to have the answers now, but that's just not the way it works. And doctors are doing the best they can with the best knowledge they have, and we're trying to let them practice medicine. That's part of the art of medicine.
But here's why, as lay people out there, and the majority of this audience, of course, here's the questions we have. We don't understand why, because this is not a new medicine. This thing has been, 40, 50, 60 years out there for malaria and a sundry of other things. It's been used. It's been tested over and over. I mean, it's almost like saying all of a sudden Bayer aspirin is very helpful and then having the president say he's taking it, and all of a sudden Bayer aspirin comes under political spotlight. But as the layman out there, there are things we don't understand. Why would you need? Point. Go ahead.
Well, that's what I was saying. That's a great point. I mean, but just as being a cardiologist, for example, vitamin E. Everybody wanted to take vitamin E years ago because it was going to help, cure heart disease and all this sort of stuff. Everybody rushed to the vitamin store to get vitamin E. But then when there were several randomized trials that looked at vitamin E, there was no benefit for it. And so now we don't prescribe vitamin E for patients with heart disease. And this is just one example.
We can say that about a lot of things. I mean, I'm not too sure about fish oil and all this other stuff.
Well, that's the other question is, people are worried about all these supplements and fish oil. And again, we thought it was beneficial. The Eskimos were eating a lot of fish in their diet, and we thought fish oil was the reason why they were doing well. Well, it turns out it may not be so helpful. It's not harmful, but it may not be as helpful as we once thought.
I was looking at some other numbers here, too, and I asked Dr. Dobbs about this because it just seems, and again, as a majority of this audience is lay people, we ask this question. What happened to flu? Where did the flu go? The flu has disappeared. Nobody's dying of the flu. Nobody's being hospitalized by the flu. We did get some interesting information yesterday from Dr. Dobbs. He said that there have been patients that we found in Mississippi that actually have the flu and COVID-19 at the same time. I guess those patients have won the battle on both of them. He didn't follow up with that. But I was looking at some stats here, and I'd ask you to comment on this. We had, so far, 57 million tests for COVID-19. 57 million tests, talking about nationwide. We've had 1.5 million tests for the entire season on flu. 1.5 million flu, 57 million on COVID. The EIP lab did confirm that the hospitalizations per 100,000 people for COVID versus the flu in the last reporting year, 2018, COVID was 130 per 100,000. Flu was 102, 28 difference in there. Only a 28 different margin in there, but at the same time you had 57 million tests for COVID and only 1.5 million for flu. What would have happened had you had 57 million for both? So I don't understand where flu has gone, and are we using some of those numbers for COVID?
Well, it's not flu season. You think about it. The typical time when flu season comes in, it's usually, when do people get flu shots? They get them in the fall because the flu hits in the wintertime. So, this is a different virus. Coronavirus is something we've never had treatment for. A lot of times, that's why we have a flu vaccine, and so we don't have as much of a problem with flu as we have with COVID. But that's the importance of, studying and trying to get the vaccinations developed so we can do the same thing with COVID. So it's a different type of virus, just like West Nile is a different type of virus than flu. People get West Nile because they were having mosquito bites and things in the summertime. So these are different viruses, and that's the challenge for it.
Well, and again, I'll remind you that was the entire year, the entire flu season for 2018, as far as that number of 1.5 million. Are you, and I know you guys get most of the information every day, and you pore over this information. Where do you think we are as far as the vaccine is concerned? Are you hopeful? I know we heard a national story on Fox this morning, maybe February, March, or spring of next year. Does that seem to be where we're headed as far as the issuance of vaccines?
Hopefully. I had a chance to talk with Dr. Deborah Birx just a few weeks ago, and the vaccination trials are ongoing. They've already started. There's two parts to it, one in August, one in September, and then we're going to have results in October, and hopefully we can mass produce it, quickly as possible. So hopefully maybe in January, but we're doing the best we can.
Are we doing some of that in Mississippi as far as studying in Mississippi?
Yeah, there are patients that are being enrolled for those trials. Absolutely.
And those trials are going on now?
They are.
Can you hold on for a second? Got a quick break here. Dr.
Sure.
Clay Hayes,
Sure.
Mississippi Medical Association. We'll be back with more. When we take a look at the hospital situation in the state, we had Dr. Luann Woodward. I think you guys were in the same medical class, were you not?
Absolutely. Luann's doing a fantastic job.
Yeah.
I have the utmost respect and confidence in her. Absolutely.
You look at the ICU beds, and she mentioned this, and I never thought about this, but it was good to hear this, that all ICU beds are not created equal. And then, regardless of that, we're getting down to the point where are we still in the critical stage as far as the availability of ICU beds in the state and certainly in the Jackson area?
Yes, it's been a challenging problem, not just the Jackson area, but all around the state,
Mm-hmm.
trying to get the patients in and taken care of, and then working them, through the hospital, because they don't just come and go. They have to be treated for a while, and then they're weak and trying to go home. And one of the challenges that we're facing is getting them out of the hospital back to, say, a skilled nursing facility or rehab center, and then going home. And that's been a real challenge.
It's my information, talking to some people, that the elective surgeries are going on in the state. Is that the word you get? Most of the elective surgeries, I'm sure they've cut back a little bit, but quite a few of the elective surgeries are going on.
Yes, we want to make sure people get taken care of. We don't need to just forget about their other problems. And so, we're doing everything we can to try to help them. Now, fortunately, one of the challenges that we had back in the spring was we didn't have enough PPE. Well, now it's gotten better, and so we've been able to do the elective surgery. So that's helped a lot.
Well, here again, one of the things that the layman out there, we ask, because we see these things about the hospitals, certainly in the rural areas or some of the smaller hospitals, are having just a heck of a time surviving. And we don't understand that because, number one, there apparently is more business there than ever before as far as COVID patients. We constantly get word that the hospital beds are filling up. We may have to, have barracks and MASH units at Camp Shelby. And then we hear that the hospitals are losing money. And we just cannot, the juxtaposition between those two things is, nobody's explained that.
Well, some of it has to do with the flex, when they're flexing for staffing. So, for example, we shut off all the elective procedures initially back in the spring. And so there was not much going on. And so the hospitals really couldn't afford to pay the staff. And so they had to kind of put people, lay them off or whatever, put them in reserve. And then now they've ramped back up. And so they're trying to catch up. And it's really more of a cash flow issue than anything else. But again, the hospitals, they have a very thin margin. And that's why they need the help from the government to try to help them get through this time. So they're trying to manage it as best they can. I've talked to a lot of CEOs of hospitals around the state, and they're doing a good job. I mean, they're trying to manage what they have in front of them, and it's just not easy. And it's the same thing with the restaurants. I mean, they're having cash flow issues, and that's why the PPE funds and the federal government that to help that back as a backstop has really helped.
I want to look at, if you start looking at some of the new data coming out, and we've talked to several people about this, the new data on young people, certainly going back to school, when they are contagious, when they're not contagious, when they can pass this on. I know the governor kind of worked this into some of his decisions yesterday, but the youngest of the young, pre-K, kindergarten, up to grade 1, 2, 3, 4, whatever it happens to be. Is that the general thinking for most of the people in the state and you at the Mississippi Medical Association, that these kids at that age, they could be asymptomatic, but they're not going to be able to pass that on, and they're not going to be able to pass it on to others? Or at what age should we start worrying about that?
Well, that's challenging to know because we just don't have enough information. We're learning all the time. But right now, the current thinking is that the younger kids are not as infectious or contagious. But that's not to say they couldn't become that way. Mm-hmm. Our biggest concern is more of the junior high school students, and it's mainly because they're not wearing masks and they're not social distancing. And I think that's the governor. I applaud the governor for his efforts in having everybody wear a mask. But getting back to your listeners, I mean, what can they do? What can they do to help us? Well, it's just the basics. Wear a mask, social distance, wash your hands, that sort of thing.
You feel pretty comfortable when you're in public and you're around some people if you do those things?
I do, although, I've gone to a few weddings. I felt a little nervous. I've worn masks. Now, you got to remember the medical community, a lot of the medical community is used to wearing masks. We wear a mask in the operating room, in the cath lab, and that sort of thing. We wear a mask all day long. So it's not unusual for us to wear a mask, and it can be done. People don't like it, but that's just part of it. Yeah. But we want to make sure we don't spread infection.
I do think, and we had a story yesterday about, and Dr. Clay Hayes is with me, we had a story about these kids going to school and wearing a mask. And the amount of oxygen they're taking in, and some of these kids are, certainly if they're playing or they're getting a little more exercise, is that injurious to their health in the long term if they wear that mask for a long period of time?
No, I mean, you think about it, when people are at high altitude, they have less oxygen levels there too. They'll get used to it. They'll be able to compensate for it. It's not like they're going to be injured. It's not like they're breathing in fibers or something like that. I'd be more concerned about young kids smoking and vaping than I would wearing a mask. I mean, let's get back to real public health. I mean, that's what we need to be thinking about.
That's a very good point, and I think that's a whole other story about those kids who've been doing that for months, if not a few years. Even if you're 17, 18, 19 years old, or if you've been doing it for a few years and you're in your 20s, if you get COVID, it's a whole different ballgame.
It is. I mean, people that vape and smoke, I mean, they are just setting themselves up for having a problem if they get COVID-19.
Have we been able to see anything, or is there any new information as far as the antibodies is concerned related to the immunity factor?
Well, we talk about herd immunity, and we're trying to get there, but we're still very, very low. Talking with Dr. Dobbs, who also is doing a fantastic job, is, herd immunity is 70% of the population. We're down around 5%. So we're nowhere close to herd immunity, and that's the concern.
Yeah, but most of the time herd immunity is a combination of vaccines and contaminations, is it not?
That is true, and that's the reason why we're pushing so hard to get the vaccines out.
Anything as far as the combination changed as far as the hydroxy with the zinc and with the Z-Pack?
No, again, there's still a lot of clinical trials going on. We're going to learn some more over the next few months, and hopefully we'll get better at this.
Final thoughts and final words to the people of the state.
I'm not a gloom and doom person. I think we're good about overcoming challenges, and hurricane seasons come along and we have more difficulties. But, if we stick together, we follow the right things, we do the basics, we social distance, we wear a mask, and we wash our hands, we'll be fine. We'll do just fine.
It is a message that sometimes resonates with people who are a little bit older, but for the young people, it goes in one ear, comes out the other. And I don't know what we can do about that one. Do you know if there's some consequences attached to the governor's edict yesterday?
I am not aware. I don't know all that. You'd have to ask his staff.
Yeah, we'll find out. Dr. Hayes, it's always a pleasure, sir. Thank you for spending some time with us.
It's